During the hearing on April 24th, we heard testimony from CMS officials and one of the contractors responsible for conducting oversight of payments for medical equipment. We invited representatives of two durable medical equipment companies, Medcare Diabetic and Medical Supplies and U.S. Healthcare Supply, to provide testimony about their company's business practices, including how their companies market and promote medical equipment supplies to patients and their doctors. We also wanted the company representatives to address sample reviews by CMS, which show very high error rates and denial rates for durable medical equipment payments made to the companies by the government. After receiving the subcommittee's invitation to testify, both individuals, through their attorneys, declined to appear voluntarily before the subcommittee. We issued subpoenas to compel their attendance at today's hearing. I regret that we were forced to use subpoenas to have the opportunity to ask these questions. I believe that these witnesses today can provide important insights about both the operations of their industry and the oversight and performance of the government. The first witness to come before us today is Mr. John Letko of U.S. Healthcare Supply, LLC. Mr. Letko, it is my understanding that let me start with this. What is your company's primary business purpose?
Chairman McCaskill, I would like to answer your question, but based upon the advice of my counsel, I respectfully decline at this time to answer your question based on my Fifth Amendment rights in the Constitution.
Okay, we respect that right under the Constitution, and we thank you for being here today. We know that your company has been speaking to the press about this issue, and we are hopeful that at some point in time your company will be in a position that you could speak to the committee under oath in the same manner that you are willing to speak to the press about this issue. And we thank you for being here today, and you are dismissed. Mr. Silverman, we appreciate you being here, and I am hopeful that we will be able to get a lot of good information out of you today. Is this a privately owned company or publicly owned?
It is privately owned, Madam Chairperson.
What did your company receive in 2012? What was the total amount of money you received for medical equipment supply payments from Medicare in 2012?
To the best of my knowledge, it was approximately $35 million.
So if someone doesn't have a computer and they're saying that they got a call from you and you had their doctor's name, you had their name, and you said that you were Medcare and they thought you meant Medicare because your name sounds just like Medicare, you don't think that that's really happening?
No, ma'am. First of all, we do not present ourselves as Medicare.
Why did you name yourself that then? Clearly it's named.
My first medical office was named American Medcare Centers, and when I left that office, that name was still in use. So I just abbreviated it to Medcare, Diabetic, and Medical Supplies.
And it's just a convenience or a coincidence that when someone calls and says this is blah, blah, blah from Medcare, that elderly people just might accidentally think they're talking to Medicare? Is it possible that any of your people working for your company, are they compensated based on how much they sell?
No, ma'am.
There's no commissions?
They're a salaried employee.
No commissions?
They
I want to make sure. You're saying that everybody at your company makes the same amount no matter how many machines they sell?
They have incentives, yeah.
Okay.
Yes.
And the incentives are based on how many machines they sell?
Not necessarily machines, or there's no monetary basis, but it's based upon who they speak to and how many orders they get.
Don't you think if they need medical equipment, it should come from their doctor and not from a go-between between the patient and the doctor, that is contacting the patient directly? One of the reasons that I'm trying to work in this area is because I think it is ripe for confusion. And I think the current system allows a lot of that also. I think that is one of the reasons why we had so many people contact our office on this subject. When we asked if they had been solicited for medical equipment directly, we got a lot of people that, you know, stepped up. And those are the ones that are paying attention to what's being said in the news or on TV about Congress. And frankly, most people right now in America just hope we go away. So the fact that we had a lot, that's from a pretty small universe, because there's a lot of people out there for a lot of good reasons that aren't paying much attention to us.
I appreciate you protecting the consumer, and it's my job too to do the right thing.
And the Treasury. Frankly, people having lots of people trying to sell them equipment, while it is disruptive and confusing to seniors, what it really is expensive for the Medicare program.